Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippines College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay, Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
Iba na kasi ang panahon ngayon. Pakiramdam mo, naglalakad kang pauwi ng hating gabi at kinakabahan ka. Yun bang kahit anong ingat mo, anytime, pwede kang matiyempuhan ng masasamang loob.
Tuwing lalabas ka ng bahay, ang dami mong iniisip na pwedeng mangyari. Para bang nasa gitna ka ng dilim. At nagdarasal ka na lang na sana may proprotekta sa'yo kung sakasakali.
Ang pandemya ay parang isang iskinita na kailangang daanan. Alam mong may nagtatago sa dilim, pero wala kang nakikita. Puno ka lagi ng pangamba. Pero may liwanag na naghihintay. May proteksyon laban sa COVID-19. May maaasahan kang backup. It's time to vac up. Oras na para magpa-COVID-19 vaccine booster for backup protection, control, and prevention. Para sa mga 5 taong gulang at pataas, eligible na kayo para sa first booster shot kung nakumpleto nyo na ang inyong vaccine primary series. If you are a senior citizen or a frontline health worker who is 18 years old or above and have completed your first booster, you are eligible for a second booster shot ayon sa Philippine Department of Health. Ang COVID-19 vaccine boosters ay nagbibigay ng karagdagang proteksyon na maaaring humina na ang bisa mula ng inyong huling vaccination. Booster shots are effective in helping prevent serious illness, hospitalization, and even death. So, stay up to date with your COVID-19 vaccination. Kasama na dito ang booster shots. Magtanong sa inyong doktor o barangay clinic kung ano ang naaangkop na COVID-19 vaccine at tamang panahon para sa inyo. Sabay-sabay nating lakbayin ang daang patungo sa malusog, malakas at magandang kinabukasan. Protect yourself and your loved ones. Help control and prevent the spread of COVID-19. It's time to back up.
Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
Iba na kasi ang panahon ngayon. Pakiramdam mo, naglalakad kang pauwi ng hating gabi at kinakabahan ka. Yun bang kahit anong ingat mo, anytime, pwede kang matiyempuhan ng masasamang loob.
Tuwing lalabas ka ng bahay, ang dami mong iniisip na pwedeng mangyari. Para bang nasa gitna ka ng dilim. At nagdarasal ka na lang na sana may proprotekta sa'yo kung sakasakali.
Ang pandemya ay parang isang iskinita na kailangang daanan. Alam mong may nagtatago sa dilim, pero wala kang nakikita. Puno ka lagi ng pangamba. Pero may liwanag na naghihintay. May proteksyon laban sa COVID-19. May maaasahan kang backup. It's time to vac up. Oras na para magpa-COVID-19 vaccine booster for backup protection, control, and prevention. Para sa mga 5 taong gulang at pataas, eligible na kayo para sa first booster shot kung nakumpleto nyo na ang inyong vaccine primary series. If you are a senior citizen or a frontline health worker who is 18 years old or above and have completed your first booster, you are eligible for a second booster shot ayon sa Philippine Department of Health. Ang COVID-19 vaccine boosters ay nagbibigay ng karagdagang proteksyon na maaaring humina na ang bisa mula ng inyong huling vaccination. Booster shots are effective in helping prevent serious illness, hospitalization, and even death. So, Stay up to date with your COVID-19 vaccination. Kasama na dito ang booster shots. Magtanong sa inyong doktor o barangay clinic kung ano ang naaangkop na COVID-19 vaccine at tamang panahon para sa inyo. Sabay-sabay nating lakbayin ang daang patungo sa malusog, malakas at magandang kinabukasan. Protect yourself and your loved ones. Help control and prevent the spread of COVID-19. It's time to back up.
Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
Through the dreadful darkness, we shall be the light and lead a path to wisdom. Our will to be our light. To those in pain and suffering, we shall hear a call. With us to care and comfort from Master above all, to praise the brighter future, bound in unity, the Trinity College of Physicians, we shall be hand in hand, building a stronger nation. This
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Forum of the Philippine College of Physicians. Our health forum is an update on HIV, DOH testing, and treatment guidelines. Maraming salamat sa regular viewers ng PCP Health Forum sa continuous support mula sa aming media partners at sa mga masugid na taga-subaybay ng PCP sa social media. I am Dr. Francis Gail Turalba, a member of the Media Communications Committee, and I will be your moderator for this health forum. So worldwide, dumadami ang mga kaso ng human immunodeficiency virus or HIV. At dumadami din ang namatay dahil sa virus na ito. Ito ay umaatake sa immune system ng ating katawan. Kung hindi ito magamot, maari itong tumuloy sa pagkakaroon ng acquired immunodeficiency syndrome o AIDS. So upang ma-prevent ang HIV at makontrol ang pagkalat, lahat tayo ay dapat ma-educate. So dahil ang pag-iwas, ma-infect nito at maagang diagnosis nito ay makakatulong sa maagang pagpapagamot sa mga na-infect ng HIV. Before we start, let us hear a welcome message from the PCP Board of Regents, South Luzon Region, Dr. Angelito Benjamin C. Belen.
President of the Philippine College of Physicians, Professor Diana Payawal, Vice President Dr. Renchen Solante, fellow members of the Board of Regents, our esteemed speaker, Dr. Caterina Leritania, members of the college, colleagues, ladies and gentlemen, good morning. The Philippine College of Physicians Health Forum, through its Committee on Media Communication, continues to bring updates on relevant and timely topics. Today, in this discussion on the updates on human immunodeficiency virus, the Department of Health testing and treatment guidelines, we hope to refresh our knowledge and skills on an issue that has been with us since the 1980s. I would like to congratulate the committee for choosing this topic. I'd like to give my heartfelt gratitude to our speaker, Dr. Leritania, who will share her expertise on the matter. And I would like to thank our colleagues and attendees who will be sharing their participation in today's activities, hoping for a very productive and fruitful discussion. Maraming salamat po. Mabuhay ang PCP.
Thank you, Dr. Belen, for the warm welcome. And now, to educate us more, we have invited an expert speaker who will update us on what we need to know about HIV, specifically the Department of Health's HIV testing and treatment guidelines. Kapag may katanungan, maaari po i-type lamang sa chat box at sasagutin ng mga ito pagkatapos ng lecture. So it is an honor to introduce our speaker. She is the Medical Director of the Sustained Health Initiatives of the Philippines Incorporated, HIV and AIDS Core Team Leader of the SHIP Clinic. She is the 2022 PCP Exemplar as Distinguished Community Leader during the Philippine College of Physicians 52nd Annual Congress. Let us all welcome our distinguished speaker, Dr. Caterina T. Leritana.
Good morning, everybody. I'd like to thank PCP for the honor of speaking to you today. Thank you to the organizers for choosing HIV as our topic for today's Lay Forum. And today I will share with you the updates on the DOH testing and treatment guidelines, two separate new guidelines which were signed this year. Napaka-importante po nitong mga ating panuntuyan upang tayo ay mag-guide sa ating clinical practice. Na hopefully siya ay maging cause para ma-improve naman natin ang ating HIV services. Pero bago ko po simulan ang pag-share ng findings sa ating guidelines, gusto ko po munang ibahagi ang current situation ng HIV sa ating bansa. In 2019, the Philippines was said to be the country with the fastest growing number of new cases of HIV in the world. The year prior to that, ang numbers po natin ay increased sa Asia Pacific, but at the rate then of a 203% increase comparing 2018 to 2010, napagtuunan na tayo nga ay mabilis ang kaso ng pag-angat ng bagong cases. If you look at our numbers as a whole, hindi siya comparable to our neighboring countries. However, it is the spike of increase in new cases which placed us in this predicament. Another highlight sa ating epidemic of HIV is that our newly diagnosed people living with HIV become younger as the decades move on. So if we look at this bar graph, comparing the early years, tingnan po natin yung red and orange bars na kung saan ito ay ating mga young people, no, from less than 15 until 34. No? Up until 34 po ang matuturing pa ring young ang ating population. No? Makikita po natin na mas lumalaki ang proportion nila as a whole as the years go on. Compare natin nung mga unang panahon na medyo may katandaan ng konti ang ating mga bagong kaso. Ngayon ay pabata siya ng pabata. So let's look at our most recent numbers. So this is according to the Department of Health HIV and AIDS report as of latest, which is the month of July. So in July of 2022, meron po tayo na diagnose sa 1,346 new HIV cases, which brings us to a rate of about 41 new cases on the average per day. Now let's stop there and look at the history. This time, last year, meron tayong 33 cases per day. Granted, ito ay post-pandemic, ibig sabihin maaring naapektuhan ng COVID lack of access to testing ang numbers natin. Pero as a whole, ang 2021 ay nagre-recover na po tayo ng ating services. Comparable na po ito sa pre-pandemic rates of 2019. Tingnan naman natin yung pre-pandemic natin ng 2019. We had about 35 cases per day. So looking at it, definitely mas mataas tayo ngayong 2022 at 41. Now, I want to also direct your attention to the number or proportion of patients who are newly diagnosed who present with advanced HIV disease. In 2022, 30% or 1/3 ng mga kaso natin ay nagpe-present ng advanced HIV disease. Paano malalaman kung advanced ito? It's either their CD4 is below 200 or they present with an opportunistic infection that is AIDS-defining. Compared to 2021, 12% lamang ang may advanced infection. And noong 2019, 18%. So definitely, mataas ang nagpe-present ng late. Importanteng matanong natin sa ating sarili, bakit late na mag-present ang mga new cases? Maraming dahilan para dito. Could be, first time talaga nilang magpa-test at ma-diagnose. Ibig sabihin, ano naman yung reason ng gap na yon from deciding to do an HIV test at yung gap ng exposure. Maaring nagpa-test na sila dati, hindi lang sila nagpa-treat. Ano naman ang mga factors ng delay in seeking care? Hanggat sa nakaramdam na sila ng mga symptoms ng opportunistic infection. Kung isipin natin, malaking bahagi talaga dito ang possible lack of awareness or also lack of access to testing. Ito yung mga bagay na kailangan natin i-address sa ating programa. Ang third highlight na gusto kong ipakita ay ang total reported number of deaths for the year. So, for the month rather. So, for July 2022, we have about 70 compared to 60 and 55 for 2021 and 2019 respectively. Again, there are many factors which may explain why there is a sort of increase in trend of deaths. We have to look at it as a whole, as a year. Ang hirap tignan siya ng per month lamang. Pero nakakapansin din na parang pataas siya ng pataas. Ano yung mga dahilan para dito? Again, multifactorial. One drastic detail that I want to share is that despite medications for HIV being shouldered by our government, not everyone is on the medication. According to the 2021 UNAIDS data sa Data Hub, only about 41% of those diagnosed with HIV in the country are on the life-saving medications. Again, why? No? Is it because of lack of awareness that there is medication, lack of knowledge where to get the medication, or another factor? So definitely this is something we need to address. Okay, I wanna talk a little bit about how our lockdown affected the HIV program. So the lockdown started noong March 12, and this is a summary of how the HIV program was affected. As a regional, member ng regional ASEAN, naka-report ang region natin ng almost half decrease in personal patient visits, and 15% were delayed or rescheduled, according to the 2020 Asian survey. And these are the reasons, according to the Global Fund naman, kung bakit nagkaroon naman ng decrease in patient attendance during the pandemic. More patients are being redirected from and to other facilities because of the attention needed to give for COVID, and the scope of specific services were reduced. Okay, admittedly, dahil sa bigat ng COVID na nangyari early on, talagang nagkaroon ng shifting of services. Maliban doon, meron talaga tayong ibang problema gaya ng reduced or changed opening hours, even facility closure, suspension of some services. So in general, nagbago yung landscape ng service. Ang reasons naman ng mga pasyente themselves for either delaying or postponing their going to clinic is fear or mistrust, uncertainty of getting infected with COVID, especially when they go to their own clinic. Siyempre, pag ang clinic nila ay bahagi ng isang tertiary hospital na maaaring mag-admit ng mga pasyente may COVID, natatakot sila na sila ay baka mahawa para makipagkita sa kanilang doktor. Nagkaroon din tayo ng disruption in public transportation at of course ang ating mga stay-at-home orders. Sa Pilipinas, ito yung mga naging direct effect ng COVID sa atin. This reflects HIV testing. Okay? From 2019 pre-pandemic, meron tayong 1.2 million testing events. Noong 2020, 477,000 na lang. It was a 61% decrease in HIV testing rates. Sa pag-utilize naman po ng condom and lube, in the whole Philippines, hindi masyado tong nadama except sa NCR. na kung saan bumaba siya na as low as 17%. Ang combined prevention package or prevention strategy ng ating HIV program ay bumaba from 26 to 17% ang utilization rate. Sayang, dahil itong combined na testing, condom and lube provision ay talagang nakatulong sa atin pre-pandemic, nakapag-increase siya ng testing practices at nakakatulong sa pag-decrease ng transmission. However, bumaba talaga siya nung pandemic. Ang nakakalungkot dito ay nagkaroon tayo ng disruption sa ating services, pero yung risk ay sustained or continuous pa din. Anong ibig sabihin na to? Sa ating mga most at-risk na population na siyang medyo vulnerable, no, to getting HIV, anal sex was still present, no, halos hindi nag-iba yung practice nito in the past 12 months. So kumbaga hindi nagbago ang mga risky behavior, pero yung access mo to preventing HIV ay bumaba. The number of anal sex partners was still the same. The number of months with anal sex still the same. Ang maganda lang dito is bumaba ang pag-i-engage ng in-cruising or ang pagpunta mo sa isang lugar sa labas ng iyong tahanan upang magkaroon ng sexual encounter. Instead, nag-shift to regular sexual partners ang ating mga miyembro ng key affected population. So, yan naman ang kumbaga silver lining, no, ng ating pagkakaroon ng mga stay-at-home orders, no, nabawasan yung pagkaroon ng casual encounters outside the regular circle ng mga sex partners. Isa pang important na service disruption during COVID ay nagkaroon tayo ng tinatawag na treatment gap, no, increase in treatment gap. Ang ART supply or ang antiretroviral therapy supply natin ay nagkaroon ng limitasyon. Nagkaroon ng limitasyon sa pag-access ng ating treatment facility at transportation ang mga pasyente natin. So, ano po bang ibig sabihin nito? Kapag ang treatment coverage natin ay bumaba at nag-increase ang treatment gap, pero at the background of continued risk, we will expect an increase in HIV infections. Okay? So hopefully that's clear. So ngayon, kung ine-expect natin in theory na dapat nagkaroon ng increase in HIV infection, na-detect ba natin itong mga increase in HIV infection? It should manifest as increase in number of cases, di ba? Pero again, hindi nga siya nakita. Instead, nagkaroon tayo ng decrease in all age groups with a total nga of 61% decrease. So, tumaas man ang transmission ng HIV, hindi natin siya nahuli. So, kung hindi natin na-diagnose ang mga pasyenteng posibleng may HIV, it could be na, number one, they are still left undiagnosed and therefore are not achieving care that they need. And second, we can expect that transmission is still going. So, hindi magiging surprising dapat na pataas ng pataas ang kaso natin. This is just the comparison ng ating testing rates. Okay? So, itong blue line, ang 2019 pre-pandemic, noong 2020 during the COVID lockdown. So definitely ang pababa ng ating testing rates. Itong 2021, at least we are trying to recover pre-pandemic rates of testing, and hopefully yung line graph natin in 2020 ay mas favorable ang picture nito. I think we might still be catching up sa mga losses natin noong 2020. And dahil dito, we still might see more patients who present ng late stage dahil sila po yung hindi nagpa-test noon, nakalimutan siguro na magpa-test na o nawala na sa kanilang self-assessment na yung na-miss kong test na dapat kong gawin ko kaya ngayon. Maaring later pa sila mag-present. So yan ang mga challenges na nakaharap namin, no? Ngayon, knowing that these are the problems and the issues that we are currently facing on top of the already high new infections natin, we are hoping that new DOH guidelines on testing and treatment can help us find solutions. The guidelines are quite long and marami siyang tinutumbok, pero pumili po ako ng mga highlights na maaring maging useful sa atin sa ating clinical practice or even in our own personal advocacy. So I'd like to share some of the highlights here with you. So there are two guidelines that I'm going to discuss. The first is under testing. The testing guideline was signed in 2022. The old one was in 2017. Sa treatment naman, it was signed in June of 2022 and the old one was in 2018. Some of these guidelines will necessitate a change in operations in many of our HIV treatment facilities. So I'm hoping that our colleagues now are beginning to review this and starting to create their own policies in the hospital or the primary care centers para ma-apply natin sila as soon as possible. Dahil ito na po sila, black and white. Okay, so isa sa mga gusto kong i-discuss under testing is yung change in the age of giving consent. Background po nung ating old testing guidelines, 18 and above can provide, ages 18 and above can provide their own consent for an HIV test. Ideally, this should be a written consent, no? Pipirmahan nila. A verbal consent can only be accepted for those who engage in community-based screening, which is the T0 or the pre-test process. Hindi pa nga siya included sa actual testing algorithm. So pag sinabing community-based screening, ito po ay yung sa labas ng facility ginagawa, care of a community peer motivator. For those aged 18 and below, kailangan dati ng consent ng parents, next of kin, or guardians. And if these if they are not available or cannot be located, proxy consent may be given by a registered social worker. So yan po ang naging patakaran. Ngayon, maaari nang magbigay ng own consent ang isang 15-year-old and above. Hindi na kailangan ng magulang or ng guardian para ibigay ang consent. Sila mismo pwede. Maaari itong written or electronic. So ngayon may telemed na tayo. Pwede na mag-electronic consent. Again, verbal is accepted for community-based screening. Now, I want to introduce you to the concept of a mature minor. A mature minor is someone who is below 15 years old who has exposure to increased sexual risk that can put him or her at risk for HIV. Ibig sabihin, siya po ay maaring nakipagtalik na, nabuntis na kung kaya tinatawag na siya ay mature minor. So yung mga young mothers natin can give their own consent kahit below 15 years old sila. Hindi na kailangan ng magulang or ng guardian. Sa mga non-mature minor, below 15, na gustong magpa-HIV test, kailangan ng parent or guardian. Ngunit, kung hindi mahanap ang parent or guardian within 7 days, or kung ayaw ipatest ng magulang ang kanyang anak below 15, maaari pong isang proxy ang magbigay ng consent kasama ng assent or verbal na pagpayag ng bata. pwede magbigay nito ay hindi lamang registered social worker, pero pati ang healthcare worker. So yung mga doktor, nurse, at mga midwife ng facility. Pwede na rin magbigay ng consent. So especially sa mga kabataan natin who are affected by the child abuse law na RA 7610, maaari pong maging kandidato para magbigay ng proxy consent. Yan. So anong magiging implication nitong bagong change sa ating guideline? Balikan natin yung data natin on young people. So sa July 2022 census, there were 77 new HIV cases aged 19 and below. Majority nito ay adolescent, mga 15 to 17, 92%. Almost all of them claimed to be sexually active, and that was how they contracted HIV. Yung mga children below 10, anim sila, with a median age of 5. Majority were documented na mother-to-child transmission. Yung dalawa, hindi alam pa kung paano nakuha. So, anong implications ng statement nito? So, okay, una, itong mga adolescent na majority of young people is that young people have sex. Okay, that's the first point I have to take. Okay, second is mother-to-child transmission is a risk for HIV and underscores the importance of testing all pregnant women so that they are given the chance to be on medication. Dahil ang isang pregnant woman, kapag siya ay uminom ng medication, maaari siyang magbigay buhay sa isang sanggol na HIV negative. So, hindi automatic na pag positive ang nanay, ay positive din ang kanyang anak. Pwede tayong makagawa ng HIV-free generation kung lahat lang ng mother-to-child transmission ay ating ma-address. Okay, so dalawang challenge po yan. Now, ang age group ng 15 and below sa ating current census is only less than 1%. So we are hoping that with the change of this guideline, we will be able to provide services to the youth na hindi na nagiging issue yung consent, walang magulang, etc. Dahil baka nami-miss natin yung pagtulong sa mga kabataan natin dahil hindi tayo nakakuha ng permiso ng magulang para makapag-test. Kawawa naman sila. Kailangan din nila ng tulong. Isa pang importante, I will show you the many reasons why much attention should be given to our young people. Among all the age groups, yung mga young people po natin have the lowest scores on HIV knowledge. And this HIV knowledge is assessed by our IHBSS, which surveys key populations every 2 years. No? 5 questions on how HIV is transmitted. Isipin mo, parang ang basic naman nun, but di nila alam. Pero nakakapagtaka na iilan lang ang makakuha ng perfect score sa 5 questions na yun. Okay? So, definitely, they need more knowledge. Second, let's understand that young people can be sexually active and they can even engage in transactional sex or giving and accepting payment in kind or in peso for sex with other people. So tingnan natin, no, ang laki ng percentage nitong 2018 IHBSS na 15 to 17-year-old who accept money for sex. Added to that, may risk na sila, low knowledge pa or HIV, low practice pa of safe preventative practices. This is the illustration of what we call as the condom lab, okay? Wherein it has been noted that 16 years old is the median age for first sex with female ng mga male, and first oral sex with male. The first anal sex happens at age 17, but the first condom use happens 19. So we're talking about 2 to 3 years of unprotected exposure of our young population, and even a more later age of first HIV test, 21 years old. So, kumbaga, pumasok ka sa gera, wala kang ammunition, wala kang sandata, wala kang shield. Ang ideal scenario nito is even way before siya ay papasok sa gera or magiging sexually active, bibigyan na natin sila ng ammunition to protect themselves. First of that is knowledge. Okay, so we're hoping that as sexual health in adolescents, including HIV prevention, is taught in formal school, not discussed at home, so that when they do decide to become sexually active at, let's say, age of 16, they know they should wear a condom, they know where to get the free condom, or they know where to buy the condom. Okay? So, challenge to sa atin, lalo sa mga educators natin and sa mga parents natin. Please don't let your child go to war unprepared. Next. Young people have the most no access. No? Sila yung pinakawalang access to prevention. Ito po yung free condom or kahit condom na binibili. No? Basic prevention natin. So, mas marami sa younger population, halos 3/4 sa kanila, absolutely no access to prevention. Yung iba nakakakuha ng free sa ating mga social hygiene clinics or yung mga groups natin na namimigay ng condom. Compare natin sa mga older population natin. And as expected, kung low access ka to prevention, low testing rates din. Di ba nakakalungkot siya? No? Parang our population ng newly diagnosed gets younger and younger, and yet sila yung pinakalugi. No? Walang kaalaman, walang access sa prevention, walang low testing rates. So we're really, really hoping na dahil binabaan yung age of consent, ay gumawa tayo ng mas maraming services para sa mga kabataan natin dahil sila ay lugi sa laban ng HIV. Okay, yun po yung first change natin sa testing. The second important change is this, no? Yung process of testing po. So sa lumang guideline natin, ang HIV test ay ginagawa sa usually sa facility. Okay? Sa facility ginagawa ng isang HIV counselor. After that, ang isang medtech ay kukuha ng dugo, kailangan HIV proficient siya. Kapag na-test po ito na reactive sa ating mga screening tests, ipapadala po ito sa ating mga standardized laboratory gaya ng SACL sa San Lazaro or ating mga RIVDA facility na rapid HIV diagnostic algorithm wherein pwede tayo makakuha ng test result ng confirmatory within 1 to 3 days. Sa lumang guideline, kahit reactive ang result mo, dahil screening lang ang ginawa sa facility, hindi ka pwedeng bigyan ng papel na nakalagay doon na reactive ka. Dahil kailangan mong hintayin yung confirmatory. No? So verbal lang. No? Ito lang yung test na hindi ka pwedeng bigyan ng resulta kung positive ka. Kasi kailangan sure na sure. Kaya kailangan yung certificate hintayin. Mabuti na lang, in between the old and new guidelines, ay meron tayong mga memo, okay, ng community-based screening na talagang pinasok yung outside of facility testing even before nagkaroon tayo ng change of guidelines. Pumasok yung RIVDA na kung saan pinaikli yung period of waiting for the confirmatory test upang mapabilis ang pag-access sa medication ng isang taong nag-test positive. Pero ngayon, black and white na, tingnan natin ano yung mga bagong lumabas sa testing guidelines. Okay. Una, dumami ang modes of testing natin. Meron tayong self-testing na kung saan ako mismo pwede kong i-test ang sarili ko, pwede ko malaman yung test result ko. Pangalawa, ang community-based testing na ito po yung second picture, no? Ginagawa siya usually sa labas ng isang facility, anywhere, no? Pwedeng bahay mo, pwedeng coffee shop, pwedeng sa labas, sa kotse, sa kalsada, anywhere na pwedeng private na magawa itong test na to. At results are out in less than 10 to 20 minutes. In 5 minutes nga, minsan alam mo na yung status mo. So, isa pang maganda is hindi na kailangan ng HIV proficient Mentec maliban sa ating mga specialized na lang. Ang reactive test sa mga method na to still pinapadala for confirmatory dahil gusto talaga natin ng certificate na yon. And lastly, nagbago na. Maaari na tayo maglabas ng reactive result on the day of test upon request ng pasyente. Kailangan lang itong pirmahan ng ating facility head or kung meron tayong pathologist, siya po. Kung wala, pwede po yung doktor. Ano po ang ibig sabihin nito? Dumadami yung options natin for testing. So kung ang limitasyon natin dati ay hindi or malayo ang testing center sa atin, pwede tayo magkaroon ng iba pang way to test ourselves. Okay, so give our clients more options for testing. Okay. It also addresses this. Sorry medyo busy slide. Pero I want to introduce to you yung concept of the cascade of care. Okay, so dito pa ito tingin sa mga red and orange na bars. Huwag po natin pansinin itong mga gray kasi ito po ay projection lamang. Ito po yung data ng time na to as of 2020. Ito pong line na ito, sila po yung estimated number of HIV in the country. Okay? And yung red po, sila po yung diagnosed. Ibig sabihin, sa mga merong HIV sa population natin, ilan lang yung na-test natin, na-diagnose natin. So, nung 2020, ang estima nila ay 111,000 ang meron. Pero 77,000 lang yung nagpa-test for HIV. So, meron tayo ditong diagnosis gap. Nasaan po itong nawawalang to na halos 50,000? Sila po yung maaring hindi nila alam kung may HIV sila. Alam mo yun, like I have the virus, but I don't know if either hindi ko alam na what is HIV, or hindi ko alam na at risk pala ako, or alam ko pero natatakot ako. Okay? So, yan ang gap na gusto nating i-address, and by increasing the options for testing, we hope that this gap decreases. Okay. In 2021, nilagyan ko na lang po ito kasi 2020 po itong graph na to, pero noong 2021, ito po yung ating score. For those who we successfully tested, 89,000, and on treatment, 56. Pero tumaas din yung ating estimated. May scoring po yan kasi meron po tayong targets na 95% of all who are HIV positive should be diagnosed, 95% of all who are diagnosed should be on treatment, and 95% of those on treatment should be suppressed or undetectable. Ito po yung goal score natin, pero ang actual score natin nung 2020 ay 69-61. Actual score natin nung 2021 is 70-63. So, hindi po natin na-meet yung target of 95-95-95. Again, this is a challenge that we are always achieving for. No? Makuha natin yan. So, again, we want to close this gap of people who have HIV but have not yet been tested by increasing our options for testing and decreasing the age of consent. Okay. Third, punta naman tayo sa treatment guidelines. Okay? Ito po yung mga highlights na gusto kong i-share. Sa lumang guidelines natin, ang HIV treatment po ay binibigay kapag ang isang pasyente na may HIV ay meron ng confirmatory test. Maaring tumagal ito mula ilang araw hanggang ilang linggo. By experience din ito namin, no? Kaya buti na lang po, mayroon na tayong faster way of confirmatory test, which is yung RIVDA, na decrease yung waiting time from usual na 2 weeks to a few days. Ngayon, sa bagong guidelines nakalaan. Kung maaari, kung walang exceptions, pwede tayong mag same-day treatment. Ibig sabihin nito, sa araw na ikaw ay nagpa-test for HIV, kung na-fulfill mo yung criteria for same day, maaari kang umuwi ng araw na yon na bit-bit mo na yung gamot mo. Okay? So, alam ng mga doktor ano yung mga criteria nito. Kasi meron din tayong mga exceptions to the rule. Pero napakagandang option na hindi na sila maghihintay. Kasi nung unang panahon po, minsan, ang mga may confirmatory test, hindi na po umabalik. Hindi na po namin alam nasaan na po sila. Okay? Ngayon, sa same-day treatment, medyo tumataas yung chance na hindi po tayo magkakaroon ng maraming fallout sa ating care. Balikan po natin yung graph kanina kasi may sariling gap po itong treatment. Ito po yun, di ba? Yung red tsaka yung orange. Ito po yung mga diagnosed and on ART or antiretroviral therapy. And this is the gap we want to address by providing the option for same-day treatment. Kasi ina-assume natin na ang paghintay ng lab test ay hindi magiging sanhi ng pagkadismaya ng isang pasyente na hindi na lang ako magagamot. Kasi, kunyari, ang tagal naman ng result ko, gusto ko na mag-treatment. Pero dahil sa katagalan, nainis na siya o nagkasakit na ng todo, na ospital na or lumala ang sakit, hindi na natuloy sa treatment. So we want to address that by hopefully providing treatment on the same day. Okay? All right. And ang third natin na important sa ating guideline ay ang pagkakaroon ng optimized regimen. Ito na mismo yung gamot na pinag-uusapan natin. Tayo po kasi, ang Pilipinas ay bansa na nakakaranas ng tulong or aid mula sa ating mga developmental partners, international partners, at ngayon, on a public health scale naman from the Department of Health na siyang namimigay ng ating libreng gamot. Ang mga options natin dati for medications ay limitado lang sa mga mura, pero effective. Pero unfortunately, may mga side effects. So throughout the years, na phase out natin yung mga grabing side effect na gamot at kinukuha natin yung mga optimized or better tolerated na regimen. And ngayon, buti na lang po, meron tayong optimized regimen na mas marami ang coverage. Ibig sabihin, hindi lang siya pang matanda. Pwede siyang pang bata, pang babae, pang buntis, pang transgender, na pill. Once a day lang siya. Napaka-effective. Kumbaga, mataas ang kanyang genetic barrier to resistance. Ibig sabihin, hindi na dahil nag-miss ka ng one tablet, resistant ka na. And less ang side effect niya. So, ito yung tinatawag ng optimized regimen na siyang nire-recommend na first line. So, ang challenge na lang sa atin is we have to be able to provide a sustained, adequate amount of the regimen for everybody. Ang isa pang pagiging optimized ng regimen is we are now allowing our clients or our patients to be able to bring home as much as 6 months worth of pills sa kanilang visit upang hindi nagiging sagabal ang HIV healthcare sa kanilang pang-araw-araw na buhay. Dahil ang mga pasyente natin ay nag-absent, no? Para lang makakuha ng gamot sa clinic, makapagpa-check up, and we want to be as non-intrusive as possible para mas mag-improve naman ang quality of life nila. And isa sa mga ways to do this is to give them a medication that doesn't really harm them, that it's just like taking vitamins. It's once a day and a lot of them, so that it is not something that their life needs to revolve around. And we're so happy na nangyari yon. So, ano ang magiging effect kapag binigyan mo ng optimized regimen ang mga pasyenteng may HIV? magkakaroon ka ng durable suppression of virus, which is your goal. Pag sinabi mong viral suppression, explain ko mamaya. Pangalawa, i-restore at ipe-preserve ang immunologic function. So, ang resistensya ng tao ay lalakas. At pangatlo, babawasan ang komplikasyon ng HIV. So, kasama sa ating cascade of care is yung suppression ng virus. Okay? So, sa pag-inom ng gamot, mula sa pagkakaroon ng detectable levels of the virus in your blood, bababa siya sa undetectable level. Okay? At kapag undetectable ang level, which doesn't mean na nawala si HIV ha, pero sobrang konti niya. So if you see here, sobrang konti niya. Anong epekto nun sa isang taong may HIV? Una, of course, effective yung gamot niya. Nagagawa ng gamot niya yung pagbaba ng virus, bumababa yung chance na yung virus ay magsiseed sa iba-ibang organ ng katawan nila at magpro-progress yung kanyang HIV to AIDS. Okay? Okay yun. Pangalawa, ang treatment mo ay magiging prevention din. So, nagpa-participate ang isang pasyenteng may HIV sa prevention ng HIV, if you can believe it. How? Because a person who is virally suppressed or undetectable ang viral load does not transmit the virus to their sexual partner even if walang kondom. Okay? Gets ba natin yon? Yun po yung campaign na U equals U. At napakahalaga ng campaign na ito, hindi lamang sa pagbigay ng peace of mind sa ating mga pasyente na hindi na sila nakakahawa, pero binibigyan sila back their dignity. Okay? Dahil for all this time, sila ay kinukutya or pinandidirihan, tinitignan na isang salot sa lipunan dahil lang sa isang virus sa katawan nila. Pero dahil sa U equals U, nagiging peaceful na, no? Wala nang guilt ang isang taong may HIV na siya ay nagbi-bring ng kumbaga harm sa mga magiging sexual partner niya. And it really is a load off one's back. Okay? Again, if you are asked, gaano kalaki ang risk na nawawala sa pag-transmit ng HIV from one person to another kung undetectable siya? No, you're always asked, anong risk? How low? The risk is 0. Okay? And I think it's a challenge to us physicians that you quantify that risk to your patient. Kasi if even ako, if I ask my patient, how much do you think na napapababa ng gamot mo yung risk mo for transmission? Bibigyan ako, siguro mga 25%. No, you have to tell them 0. You cannot transmit HIV as long as you're undetectable. So that is impetus for them to, then I want to be undetectable. So I will be on my meds. I'll take them regularly so that I can always achieve this grade. No? Para ka nang bibigyan ng grade sa kanila. And ang responsibility naman natin as physicians is to ensure that we always provide that test for them, okay, on an annual basis. And when starting as early as 3 to 6 months. Okay. Okay, ito yung sinasabi ko sa iyo, kasama yan sa cascade of care. Ito yung third or fourth cascade, no? So, ito nga lang ang hirap sa Pilipinas. Hindi kasi lahat ng mga facility natin ay kayang magpa-viral load. Pero, sa mga facility na kaya magpa-viral load is 96% ng viral suppression. So, interpret natin itong chart. Noong 2019, ito yung mga nagagamot. So, ideally, ganito rin kadami yung i-viral load mo. Pero dahil wala tayong makina sa lahat ng clinic, iilan lang yung meron tayong gap na dapat i-address. Pero sa mga nagpa-test, ito, ang taas, no? Almost everybody is virally suppressed. So kung ito lang titignan natin, barang makakuha natin yung 95%, kasi 96%. Pero we cannot say that because di ba? What about this gap? So challenge naman yan sa ating gobyerno. Mag-provide tayo ng viral load testing sa lahat. Okay? Kasi obligasyon natin yun eh. Part yun ng standard of care ng HIV na pwede mo silang i-viral load. Okay? Yan. So, ginagawa naman yan natin, hopefully, ng DOH. Kung wala mismo yung machine, access to a nearby place na may viral load. So, kahit referral lang. So, kahit may regional center for viral load man lang, we can start there. Okay? So, hopefully, when we get our future numbers, this will be better. Okay? Yan. Ano pa ang pwede maging effect ng isang optimized regimen? Maaring mababawasan yung clients natin na lost to follow up. Kung ang reason for lost to follow up ng isang kliyente ay ang side effect ng gamot, maaring makakabawi ka dito dahil yung gamot na ibibigay mo na optimized, halos walang side effect. So better tolerated. Mas maengganyo silang mag-refill. Pangalawa, kung kaya mo magbigay ng enough supply na hindi madi-disrupt yung buhay ng pasyente, baka hindi rin sila maging lost to follow up. So sa mga areas na kung saan gamot ang dahilan ng lost to follow up, giving them an optimized regimen will definitely help. Okay? So we want to see less loss to follow up. Pero again, ang loss to follow up ay multifactorial. Pwedeng personal reasons, o yun, life happens. Sa pasyente, may mga personal and family reasons sila. Pangalawa, pwedeng mental health issues. Pangatlo, pwedeng treatment fatigue. And pang-apat, yung mga reasons surrounding the medication. Okay, so in summary, okay, if you look at the title of our guidelines, keyword is differentiated. Okay? Differentiated approach to testing and treatment of HIV in the Philippines aims to address our shortcomings of low testing rates, low medication uptake, sustained transmission, loss to follow up by the following. Ito lang po yung mga ito yung mga highlight ko, pero marami pa pong changes. So I encourage you to read the whole guideline. No? So now younger patients may give consent for HIV testing. There are more options for testing. Same-day treatment is an option and an optimized regimen is now available. So binanggit ko yung word na differentiated. So let's define it. What is differentiated service delivery? It is a client-centered approach that simplifies and adapts HIV services across the cascade. Remember yung cascade natin, yung 95, 95, 95. In each cascade, there is an opportunity to simplify and adapt your HIV service. Differentiated service delivery should reflect the preferences, expectations, and needs of people living with and vulnerable to HIV, while reducing unnecessary burdens on the health system. DSD enhances client outcomes, enhances quality of care, ensures that the health system functions efficiently, and enables the health system to refocus resources to those most in need. So hindi lang siya pro-patient, pro-facility, and pro healthcare provider din siya. Kasi you can now have the chance to focus on those most in need while letting those who are healthy and well be more in control of their own health. Okay? So ito po ang link sa ating mga full guidelines. Maaari nyo pong picturean ito or i-save yung link na ito. But they are in the DOH website. Okay? Pag sa DOH website, click nyo po ito sa under policy and law. And then type mo lang sa search yung HIV. Yun po yung unang dalawang lalabas na search results. And you can save that. Okay, and I think that's it. Maraming salamat po sa inyong pakikinig.
Thank you very much, Dr. Kate, for that very clear, very informative, and very interesting lecture. I'm sure marami pong tanong. Actually, binabaha po tayo ng tanong ngayon, Dr. So, we'll go through it one by one. We have almost 500 attendees, and of course, their questions ay mga tanong, especially on consent and testing. It's actually an eye-opener to see that in the Philippines, there's 203% increase in HIV cases since 2010, Dr. So somebody is asking if it is possible to request for a copy of the presentation, especially the guidelines being presented. Marami pong interested po makuhang copy ng lecture po ninyo. So if it...
Yes po, sure po.
Okay, Dr. So, I'll start with the questions on consent. There's a question here. Isn't it that consent only delays the diagnosis and treatment?
Okay. Sige. So, HIV po, HIV testing is one of the tests wherein it is explicit that you will get the consent, no, of the patient. Hindi po tayo pwede mag-test ng mandatory sa bansa natin. May mga bansa, ibang bansa na kung saan required ang testing for pre-employment, pero sa Pilipinas po hindi po. May mga certain instances lang po, gaya ng organization, it is a safety issue, but it's always with consent. In fact, it should be accepted that if a patient is not ready to take the HIV test, it is taken as a decision or regarding autonomy, and you'll accept that. And our role here is to encourage the patient to be tested in the future. So provide information, keep on encouraging, but it should always be an autonomous decision.
Another question, Dr. For proxy consent of non-mature minor, if the healthcare worker will request for the test but the child refuses to, can this test still be done?
Hindi po, kasi required po yung assent, no? Yung bata mismo, kailangan po siyang umokay doon sa procedure.
Okay, so another question, Doctor, is HIV education included in the school curriculum?
I'm not the right person to ask, but alam ko ganito, ang QC kasi published their health books na merong HIV education doon. At what I'm sure of, even pre-pandemic, no, it is spearheaded by si Dr. Rolly Cruz. So, for QC, sure ako. Hindi ko lang alam sa ibang school, and I'm sorry kung meron pala, sinasabi kong wala. Pero napakaganda kung meron. Alam ko meron tayong adolescent sexual health, sexual reproduction and health subjects, and I'm hoping that it's included there.
Okay, Dr. Hopefully later on makasama na to sa curriculum, no? Another question is, what are the challenges that testing and treatment are facing in reference to the culture and stigma of the Filipinos?
Loaded question. Okay. Ang kagandahan po is among those members of our key affected population. So meron tayong tinatawag na key affected population. Ito yung mga special populations na kung saan we find that there is higher risk of HIV among them. So ito po example MSM, people who inject drugs, people who work in people who do sex work, people in enclosed locations like prisons and rehab centers. Most of our programs are targeted, no, towards our key affected populations. So yung mga messaging, advocacies, awareness are all kumbaga given to this specific population in the hopes that our epidemic can be vastly affected if these populations also reflect improvement. So among our key affected, especially the MSM, mataas ang knowledge. Okay? So mataas din ang kanilang utility, usage ng ating services as you grow older. However, ang challenge nga natin is yung sa mga hindi natin masyadong nare-reach. Example, yung mga PWIDs or people who inject drugs. Ang transgender population natin, hindi gaanong kasing taas yung testing rates compared to MSM and especially the youth. So, challenge is sana magkaroon tayo ng equal efforts across the key affected populations to provide more awareness. Now, culture-wise, I hope that I'm just not speaking from an area of dahil ito yung nakikita ko parate, feeling ko buong mundo ganito, no? Pero at least for condom use, compared to a decade ago, I'm seeing better usage and acceptance of the condom. Kung dati po ang condom, ang paggamit ng condom ay tinitignan na isang bagay na parang nakakapang suspect siya, no? Parang, ba't ka magko-condom? Kasi meron ka ba tinatago? Ngayon, ang culture ng mga kabataan ngayon is, magko-condom ako kasi yun ang dapat kong gawin. So this culture change is a good thing that I see. I don't know what brought it on, time, exposure to media, or maturity ng mga kabataan ngayon, pero I'm glad to see it. Still need to see more of it, more responsibility, more acceptance of prevention mechanisms in everybody else. Yun.
Ang dami pong magandang message from you, Dr. But we also have another question. Compared with anal sex, is transmission of HIV less with oral sex?
Yes, that's a yes. No, so anal sex is higher, followed receptive, and then penetrative vaginal sex, and then pinaka low to almost negligible po yung oral sex.
And then how soon after exposure can we request for the rapid HIV test?
Okay, so the rapid HIV test depends kung ito po ay third generation or fourth generation. Fourth generation includes an antigen, which means you can you can be able to detect the test much earlier. It has a shorter window period of about 10 days versus yung ating third generation, which is the one that's most available sa atin, with a longer window period. But still, okay, even if your client tests negative on the first test, remember there's a window period. And that's why you will need to encourage them to test another. Okay, even though we're negative today, we have to close the book on this exposure, and you need to test after a month, okay, 4 to 6 weeks, para masabi mo talaga na itong exposure mo 2 weeks ago is really negative.
Okay.
You can't tell on the first test, no, unless it's way after. But to answer your question, how short? As early as 10 days for a fourth generation and 2 to 3 weeks for a third generation test.
So malinaw po yan, Dr. Will giving post-exposure prophylaxis affect result of the HIV test? Will it result in a false negative test?
So post-exposure prophylaxis is providing ART short-term to someone who is in a risky situation within 72 hours of exposure. Okay, so i-unpack natin yon. Within 72 hours and you do that HIV test, you absolutely cannot tell if the negative test is final kasi nga may window period tayo. But because the post-exposure prophylaxis aims to prevent HIV infection development in that person, your goal at the end of it is to really have a negative result. So after you do the 28 to 30 days of taking the meds, you do an HIV test and you expect someone to be negative. And if sakto ka sa 72-hour golden time frame, you can prevent your patient from getting HIV 81% and above success rate.
Okay. Actually, Dr. we have a lot of questions coming in, but we'll try to answer everybody, no? But here there's an interesting question. Meron po ba tayong latest data tungkol sa mga buntis na nag-HIV test at ilan ang tumatanggap ng ART?
Yeah, yes. So actually nandun po yung sa HARP report. Ang alam ko lang po for the month of July, 8. Okay, 8 yung buntis na na-diagnose. Hindi po natin alam kung ano po yung total number of buntis on ART kasi manganganak din sila after 9 months. So, mawawala rin sila sa bilang. Pero there's a section there on pregnant women. Please go to DOH. Nandun din po yung monthly po yun. Monthly ang ating HARP report. So, it's really a good source of data.
Okay, Doctor. So, somebody else is asking, ask po sana if we still give IPT for people living with HIV who were treatment completers for PTD. From a pragmatic point of view, we are still mandated to comply with IPT provision. We would like to ask your thought on this.
All right. So, sa programmatic, IPT is given to those who are TB negative on screening. Pero it doesn't really say that you can provide secondary prophylaxis after treatment, but it is good practice. So, kung yung tanong mo is programmatic, hindi nila in-encourage kasi ang ano lang nila doon is, if positive siya, treat mo for TB. Pag negative siya, i-IPT mo. Pero good practice yung after treatment for TB, you provide secondary prophylaxis.
Okay. Another question, Doktora, may requirements daw po ba or kailangan ng training ng medtech bago po makapag-release ng reactive result? Or kahit wala na po basta RMT, pwede po mag-release ng result? Lalo na wala daw pong pathology.
Alright. Sa pag-release ng result, kung wala na pong pathologist, yung inyong RHU doctor po, yun po yung pwedeng mag-sign ng result ayon sa ating guideline. Alam naman po kasi ng DOH na hindi lahat ng RHU may pathologist. Pero hopefully meron kayong attending hack physician na pwede mag-sign.
Okay, another question, Doctor. Is it advisable to test compliant patients if they're already undetectable? What are the chances they won't be complacent and end up positive again?
So always pong HIV positive ang mga pasyente, no? Whether they're detectable or not. Pero as part of care, required po talaga tayong mag-monitor ng viral load. After you initiate ARV, 3 to 6 months after, you will test for viral load, and then it will guide you whether to consider treatment failure or to continue. Once you are undetectable, you will do it on an annual basis. Yun. So annually, dapat may viral load po kasi siya yung earliest determinant whether your treatment is working or not.
Okay. Another question po, result forms are not provided in the new treatment guidelines. Will we generate our own result forms for T0, reactive or non-reactive?
Pwede ko pong i-elevate yung question niyo po kung meron silang template na gustong ibigay, pero tama po kayo, walang template doon. For now, habang wala, I think you can generate, but if the DOH comes out with their official template, then we should use that.
Okay, and then some patients come asking for HIV testing in HMO clinics. Can we give the request if we are not trained counselors?
Yes. So there's something that we call PICT, Provider Initiated Counseling and Testing. Okay, so as a provider, you can encourage your patients to do an HIV test. Hindi po kailangan ng special training. Please do. No, there's no reason why we cannot encourage people to test or give a request for HIV testing.
I think we're down to last three questions. Is the new predominant HIV-1 subtype in the Philippines greatly contributing to the increased advanced HIV disease in newly diagnosed cases?
Pwede yan, sir. So ito yung CRF AE1. It does quicken the interval from diagnosis to development of advanced HIV. So instead of yung before na 10 years pa bago ako magkaroon ng AIDS, ngayon for these CRFs 3 to 3.5 years. So yung latency period ng isang pasyente ay shorter. So pwede nga pong meron sila ng advanced presentation at a shorter time frame.
I think we have a lot of medtechs attending, no? May mga tatanong po about proficiency, parang exams. Ask po kung hindi na kailangan ng RMT HIV proficient in HIV testing.
Ay, hindi ko masagot. And, si Dr. Telan po makakasagot yan or ang ating HIV program. Sorry po.
Yes, okay po, Dr. I think this will be the last question for us. Is there a law that says it's a crime for an HIV positive person to have sex with someone without disclosing the status?
Okay, so our law, the new law is RA 11166. Okay, in that law, it is highly encouraged that a person living with HIV discloses to his or her partner discloses prior to exposure, I guess. Sorry, hindi ko memorize. Pero hindi siya required. Okay? It's encouraged, hindi required, and hindi rin siya punitive. Okay? So, yun. Wala pong assault in our law.
Okay. I apologize if I can't read all the questions. We have a lot coming in. But this is proof that your lecture, Dr., has been very valuable to our audience. I'd like to ask last words from you before we proceed to the closing.
So thank you, PCP, for giving me this opportunity to share some new findings and also the state of our country with regards to HIV. I believe that all providers have a responsibility to help turn our pandemic around. And however, it is not only the medical field's responsibility. It is something that can be started from each of our homes as parents, as siblings. Mere talking about HIV and sexual risk openly, opening that communication line, especially with our youth, can help pave the road to prevention. And hopefully we can also see many efforts in our department, in our formal education to increase awareness. And HIV testing provision is a universal, it's part of a universal service that we should be able to provide under UHC. So as the whole country prepares to transitioning to universal healthcare, remember that each of the primary healthcare units should be able to provide that. And let us remove barriers instead of instilling it. As providers, let's make HIV services more available in our own way. So maraming salamat po.
Thank you very much, Dr. Kate Leritana, for your wonderful lecture, for educating all of us this morning. Before we end, let us hear our final take-home message from Dr. Alex T. Junya, the PCP Board of Regents, Visayas Region.
Hi, good morning, everyone. So first and foremost, on behalf of the PCP Board, I'd like to express my appreciation to the speaker, Dr. Kate Leritana, our moderator, Dr. Alba, and the Committee on Media Communications for this very important media forum. So after dealing mainly with COVID-19 in the past 2 years, we're now able to shift our focus on the other pandemic. So this morning's discussion has made us more aware of this preventable and treatable menace that is HIV/AIDS. So our deepest gratitude also goes to those who attended this media forum, and we hope that we will all be partners in helping spread awareness about prevention and testing about the disease. And finally, my deepest thanks to the PCP Secretariat and technical staff for their priceless contributions and for running a very smooth event. Till the next media forum, please stay safe, everyone. Thank you.
Thank you very much, Dr. Junya. Sigurado ako marami tayong natutunan sa lecture ngayong umaga. Isa sa take-home message ay dapat natin tandaan. Ang age for consent is now 15 years old, may mature minor and non-mature minor. So there's a younger age for consent. A person living with HIV who has an undetectable viral load does not transmit the virus. And we have more options for testing. The earlier you get tested, the earlier the diagnosis, the earlier the treatment. And the treatment is available in the Philippines, and there is a same-day treatment. Inaanyayahan lahat na umattend sa susunod na PCP Health Forum on leptospirosis. We are also inviting everyone to attend the PCP Mid-Year Convention this November 18 to 19 at Subic Bay Exhibition and Convention Center. Salamat sa pag-attend sa ating PCP Health Forum. Maaari po panoorin ito ulit ang episode na ito sa PCP Facebook page. So this will be made available in our Facebook page for you to watch again. Abangan po natin ang mga susunod na PCP Health Forum. Maraming salamat po. Stay healthy, stay safe.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.